everybody, my name is Luella Stanley. I am the CEO of First Aid Action, RTO 31668 in Brisbane, and I'm also children's author empowering young children with life-saving skills. So what I'd like you to teach you today is, do you actually know how to treat an infant, or perhaps maybe it's your baby who happens to be choking on food? So this is Jack, and I'm going to demonstrate on what to do. So here I am pretending to give Jack some food on this spoon. So in goes the food, and Jack swallows it, but he starts to cough and cry, as babies do when they're upset when something doesn't go right. So because he's making noise, we call it just a partial obstruction. So the airway's not completely blocked. If they can get air, they're breathing, they're coughing, they're crying. Now, a big myth is that you hit them on their back, which is most people's reaction, but it's probably one of the worst things we can do for our baby, is that we can actually cause the blockage to go further down the airway. So if it's a partial blockage, the baby can cough, cry, make some noise and breathe. I would personally look at my baby's mouth to see if there was anything in the cheek area that I could just quickly scoop out with my finger. Don't ever go digging for it if it's in the back of the throat, because you could actually push it down further. So have a look in the baby's mouth. You can just get your baby to either just lean right forward and just encourage them to cough, or you can also get them over your lap, and get them to cough. So come on, Jack, keep on coughing, keep on coughing. So either or will be fine. But if it's not coming out, please call an ambulance and call them early. My saying when I teach first aid is always, if in doubt, you ship them out, and ship them out early, just in case things go wrong. In other words, get worse, okay? So that's what we do for a partial obstruction. So we encourage coughing. If it's not working, you've got a feeling it's not coming out, please call an ambulance. Let's go backwards. So this time, I've got my spoonful of food and I'm giving Jack some mushy vegetable. This time he swallows it, but a lot of it ends up in his airway. So this time he's changing colour, he's not making any noise, he's starting to turn blue in the lips, he can't cough, he can't cry, so we call that a complete airway obstruction. So stay calm. It's happened to my son before, and being your own, you're always a bit more panicky, but it's really important that you stay calm. If you've got anybody there with you, get them to call the ambulance straight away. I would look in Jack's mouth to see again if there was anything that I could safely pull out with my finger, but again, never go pushing it down. You want to get your baby over your lap with the head down. All right, so over your lap, between the shoulder blades. You're going to give them what we call 5 back slaps between the shoulder blades, just using your fingers. So we go 1 and look if anything's come out, 2 and look again, 3 and look again, 4 and look again, and 5. Always looking after each one to see whether Jack spat anything out. Now he hasn't, so I would turn him onto his side. I check his little mouth to see if there's any food that's come out. If he's still conscious, we do what we call chest thrusts. So I've got Jack in my arms. My arms is between his legs and I'm holding his head. So now we do what we call chest thrust. So I've got 2 fingers on his chest where you would normally do CPR, but these are pushes in the chest. So we're trying to use the air from the lungs to force the blockage up. So they're not as quick as CPR, they're a bit slower, but a bit more of a sharper push. So it's 1 and look, 2 and look, 3 and look, 4 and look, 5 and look. So I'm just looking after each one to see whether Jack actually brings anything up, or if he starts to cough. If he starts to cough, I'd sit him up and let him cough, or turn him onto his side. If nothing's happened and he's still conscious, we keep alternating. So we flip him back onto his stomach again. Okay, I've got him down over my lap to let gravity help, and again 5 more on the back. So 1 and look, 2 and look, 3 and look, 4 and look, 5 and look. So again, he hasn't spat anything out. I'll check his little mouth again. If he's still conscious, I'll roll him back on his back, and then 5 more chest thrusts. So on his little chest here, on his sternum, and just using my fingers. So 1 and look, 2 and look, 3 and look, 4 and look, 5 and look, and we keep alternating with 5 back slaps and 5 chest thrusts. So these are the guidelines from the Australian Resus Council. If you're another country, just please check the guidelines from your country, but these are effective method in Australia. So we keep doing that. Please make sure an ambulance has been called. If Jack becomes unconscious, I go back to what we call Doctor's ABCD, which I have posted on a previous post that you can search for, and basically we start doing CPR if Jack is unconscious and not breathing, and if you have a defibrillator, attach a defibrillator suitable for an infant. Okay, so please stay tuned. Jump onto my YouTube channel, Luella Stanley Life Skills Kids. I will be getting my little niece to show you how it's done, because she knows how to treat a friend and a baby with choking. And it's always good to empower your children with that knowledge, just in case you've got your back turned on them and they can help their siblings, or you happen to not be around and they're eating, so they can help one another. Okay then, all right, bye.